All right, let's get right into it. Today we're talking about something absolutely critical for any of us in the hair restoration field, mastering contraindications. This is all about ensuring our patients are safe and that our treatments are actually effective.
So before we even think about a procedure, this is the #1 question we have to ask ourselves. Getting this right isn't just about good aesthetics. It's really the core of our clinical responsibility. It's all about patient safety.
That's exactly why having a rock-solid screening process is so important. It's our first line of defense. It helps us avoid complications, and just as importantly, it helps us set realistic expectations right from the very beginning. So, let's start by looking at a patient's internal health, those systemic issues that can be a hard stop. So, let's start with the big picture, right? The patient's overall systemic health. These underlying conditions can have a huge impact on whether they're a good candidate for any hair restoration treatment. Doesn't matter if it's PRP, microneedling, or even a full transplant.
I want you to think of these as, well, they're basically major roadblocks to recovery. With uncontrolled diabetes, you're looking at impaired healing and a much higher risk of infection. Severe heart conditions, even the minor stress of a procedure can be risky. And of course, with bleeding disorders, the entire risk profile for treatments like microneedling just changes completely.
Now, this is where things can get a little tricky, because these conditions can really muddy the waters. Autoimmune disorders, for example, can cause unpredictable flare-ups and pretty erratic treatment outcomes. And here's the critical part. We have to figure out if the hair loss is actually just a symptom of something else, like a thyroid issue. Because if it is, our treatments won't work until that root cause is dealt with. Okay, so once we've got a handle on the systemic side of things, we need to zoom in. Let's get up close and look at the treatment area itself. The condition of the scalp is the next make-or-break piece of this puzzle.
Look, going ahead with any procedure when the scalp is already compromised is just asking for trouble. An active condition like folliculitis or psoriasis can be made so much worse by a treatment. You're looking at delayed healing and a very unhappy patient. It's really a non-starter.
And here's the thing to always keep in mind. We're not just working on hair follicles in isolation. We are treating the skin, which is a complex organ. The health of that local environment is everything. You just can't build a strong house on a shaky foundation. It's as simple as that.
We've also got to be super vigilant about a patient's history with scarring. If they're prone to keloids or hypertrophic scars, any procedure with needles or incisions could trigger a really bad response. And we have to be able to spot these very specific scarring alopecias.
And this is a fantastic example of why getting that diagnosis right is everything. A condition like lichen planopilaris needs a totally different game plan. Usually it means a referral to a dermatologist. Trying to apply a standard restoration treatment here would not only be ineffective, it could be downright harmful.
All right, last but not least, let's talk about external factors. These are the things that are often tied to a patient's medications or their day-to-day habits, but believe me, they can have a massive impact on whether they're even a candidate for treatment.
This part of the patient intake is just non-negotiable. First up, life stage. Pregnancy and breastfeeding are pretty much absolute contraindications for most treatments. Then you've got to dig into their medication history. Things like immunosuppressants can directly work against what we're trying to achieve. And finally, you have to think about treatment-specific risks, like how low-level laser therapy might trigger seizures in an epileptic patient.
And this can be a tough conversation, but we have to be really straight with our patients about their lifestyle. Smoking, especially, is a direct saboteur of what we're trying to do. It constricts blood vessels, which kills the blood flow to the scalp. It completely undermines the healing and growth that our treatments depend on.
So the big question is, how do we pull all of this together into a workflow that's consistent and, reliable every single time? Well, this 4-step protocol is a great way to do it. It really should be a non-negotiable part of every single consultation.
If you follow these 4 steps, you're not just protecting the patient, you're protecting yourself and your practice. You start with a really deep assessment, move on to smart safety checks like patch testing, make sure communication is crystal clear with informed consent, and then you finish strong with clear aftercare instructions.
And let's just double-click on that informed consent piece for a second. Managing expectations, it is everything. Our skill in the procedure room is only half the battle. Making sure the patient's hopes are aligned with what's actually possible is just as important for a successful outcome, and frankly, for their long-term happiness.
So I want to leave you with this final thought, and it's a big one. Our field is always changing, right? There are new treatments and new technologies popping up all the time. That means our screening protocols can't afford to be static.
Our commitment to patient safety means we have to be lifelong learners, constantly updating how we assess our patients so we're always practicing at the highest possible standard.